Peripheral arterial disease, also known as PAD, is a disease that results from the buildup of cholesterol and plaque in the arteries of your lower extremities.
Peripheral artery disease of the lower extremities is a very common problem. It begins with cholesterol and plaque buildup in the arteries that limits blood flow and causes symptoms and limits people's ability to walk comfortably. Peripheral artery disease is caused by a number of risk factors that lead to plaque buildup in the arteries. Those risk factors include diabetes, smoking. We see this disease commonly in the elderly. Those two conditions are really interconnected tightly because patients who neglect their diabetes tend to have more complicated issues related to peripheral artery disease, whereas patients who, even if they present complicated, if we can get them fixed and restored and address their acute issue, if we get them walking and exercising and living a healthier lifestyle, tend to have less issues with both diabetes and peripheral artery disease. Peripheral artery disease is something that patients live with forever. It's just a matter of how we can manage the rate of progression and help to promote other healthy lifestyle choices that also address some of the other factors that led to the PAD in the first place.
When individuals have PAD or peripheral arterial disease, what you may experience it may be an ache in your calves, in your thighs, in your buttocks. It could be a burning or a discomfort, or it could be an acute pain. And that pain usually occurs after you've been active for a short period of time. So at rest, you may not have any symptoms. But when you start to become active, whether you're doing things around the house, walking with your family, you'll start to notice some symptoms in your legs that cause you to want to rest. And that may be a symptom that brings people into their physicians. Many times, though, people don't raise this topic with their physicians. Your physician may choose to do some testing of how the blood is flowing in your lower extremities just to make sure that you aren't at risk for PAD.
Peripheral artery disease really starts with the physical exam and patient history, history being the most important. Patients' symptoms really help to guide the further evaluation and then potential treatment of peripheral artery disease. But we can detect peripheral artery disease with a physical exam, such as simply feeling the pulses or assessing blood flow in the feet.
So we may get an ultrasound to see what the blood flow is in the leg. Sometimes we check the blood pressure in the leg, and that can be very useful because the blood pressure in the leg should be the same as the blood pressure in the arm. And if the blood pressure in the leg is lower, then that tells us there's a blockage somewhere in the leg. We can even check the blood pressure at multiple levels in the leg, and if there's a drop at a given level, we know that there's a blockage between those two. More invasive testing would be like a CT scan, and that'll actually give us a picture of where those blockages are and can help us with planning for surgical intervention or putting a stent in the patient.
If you've been diagnosed with PAD, it's very important that you also be aware that this could predispose you to other significant cardiovascular events such as heart disease, stroke, a heart attack, because the same types of causes related to the buildup of cholesterol and plaque in your arteries that are affecting your legs are affecting your heart. They could affect the blood vessels that go to your brain, your eyes. So PAD can be an early indicator that you need to have your physician discuss with you other diseases you may be at risk for.
Peripheral artery disease is extremely important to diagnose for two very important reasons. First off, it is associated with a high risk of heart attack and stroke. Patients with peripheral artery disease, in fact, are just as high a risk of having a heart attack, and in some populations, higher risk of having a heart attack than people with diagnosed coronary heart disease. And stroke is a really common problem for patients with peripheral artery disease too. So when we diagnose PAD, we really work hard to help reduce the risk of heart attack and stroke. The other reason peripheral artery disease is important to diagnose is that it impacts and impairs patients' quality of life. And we can do a lot of things to improve quality of life and promote independence and make people feel a lot more comfortable with walking and exercise, which is an important part of the treatment program.